Hi, we're going to see skin marking for the Peroneus Brevis muscle flap. First of all, the bony landmark like lateral malleolus and the fibula has been marked. The fibula is outlined now, and following marking the fibula, the leg is divided into three parts. As you all know, the anatomical aspect, the muscle is arising from the lower two-third of the lateral surface of the fibula and the anterior and also posterolateral intramuscular septum. The muscle is getting originated so that the leg is divided into three parts. And we are marking the Peroneus brevis muscle, which will be lying underneath the Peroneus longus muscle. As you all know, the Peroneus brevis muscle is a type 4 muscle which is reclassified following Matheson-Nagai as a type 2 muscle. And the muscle is getting inserted into the 5th metatarsal bone, that is the base of 5th metatarsal, and proximally the muscle is getting supply from the peroneal artery. And distally the muscle is getting supply from the peroneal artery, sometimes from the posterior tibial artery. In case when the flap is planned based upon the distal perforator, at least 6 to 8 cm from the lateral malleolus, the pivot point can be considered. And when it is planned proximally based, at least 4 cm from the proximal most point of the origin of the muscle is considered. And you can also see the sizable perforator which is supplying the muscle can be taken, and based upon that perforator which is supplying the muscle, the flap can be rotated and cover the defect. The Peroneus brevis muscle flap is considered as a workhorse flap for covering small to medium sized defect in the lower leg ankle region. The main advantage of the flap is its reliable vascularity, minimal donor side morbidity, and technically straightforward with good cosmetic outcome. And there are some few disadvantages with the Peroneus brevis muscle flap, which is limited size, that is it can cover only small to medium sized defect. Now we are coming to the flap marking. Again, the fibula has been outlined here, and the posterolateral intramuscular septum between the posterior compartment and the lateral compartment is outlined. And now the leg is divided into three parts, and pivot point from the lateral malleolus is taken, that is 6 to 8 cm from the lateral malleolus. And for proximally based Peroneus muscle flap, it's 4 cm as we discussed prior. And considering the axis of the fibula slightly posterior to the axis, we can make a straight line incision or a lazy incision to expose the muscle, and it's better to prefer the straight line incision in order to prevent damage to the peroneal perforators, which can be used as a lifeboat flap to cover the defect when there is a flap loss. And now we are showing the arc of rotation of the Peroneus brevis muscle flap, which is distally based. And now we are showing the arc of rotation of the peroneus brevis muscle flap when it is a proximally based muscle flap. Thanks for watching.